Hello and welcome to the COVID-19 Data Project Dataset Tour. Thank you so much for joining us today. Honestly, we're so honored to be sharing our project with you and also to give you a tour of the data that we've been collecting over this past year. My name is Tracy Flood. I'm the CEO and co-founder of BroadStreet. BroadStreet is a software and data company for social good and the backbone organization of the COVID-19 Data Project. Joining me today are the track managers, Kelsey Skogstad, Sarwat Siddiqui, Sabrine Benzakour, Aisha Salim, and Allison Muir. During this webinar, we're going to start by learning a little bit about the COVID-19 Data Project. We can answer the question, what is the project? Why do we exist in the first place? What are our objectives? And what data do we collect? Then we'll hear a little bit more information from each of the track managers. Each of them are overseeing 4 different data collection efforts, and they'll each be going over data collection methods as well as common challenges and limitations and possibilities for the data. Then perhaps most importantly, Aisha will be showing us where you can find both the methods and the data set for your own research. At the end of the session, we do hope to have plenty of time to answer your questions. First, I'd like to tell you a little bit about us. The COVID-19 Data Project started just over a year ago. Currently, we have over 400 active intern volunteers on the project. We've seen over 1,000 volunteers, all working remotely, all contributing towards a crowdsourced data sets and doing quality assurance on multiple COVID-19 related data sets. The majority of the interns were recruited from data science classes in schools of public health. They're grad students, and honestly span all ages and multiple different countries and time zones. Here in the project, we want to play our part, honestly, just to prevent another pandemic. To do this, we had 2 objectives. The first was to provide good data. We want to create a comprehensive, accurate, and easy to use data set that can be viewed by anyone online and used by researchers. The second objective is to support our interns. This past year was very disruptive for learners and students and people early in their careers, and we wanted to be sure that we did our part to make sure that they became successful in their respective fields and even leaders in data systems and public health in the future. Now you might be asking yourself, why is a 100+ person workforce even necessary? Well, if you remember, just over a year ago when the pandemic hit, the public data infrastructure in the United States just wasn't quite ready. The states were all different. They were all reporting in very unique ways. And honestly, the BroadStreet COVID-19 Data Project was amongst the first organizations to notice this and then to bring together and unify the data sources to publish a national county level map. By now, federal data are getting so much better and there's other aggregators collecting information. What we found this past year was that really in order to have the high quality data that we believe will empower community-based research, we frankly just needed to collect it ourselves. And we also wanted to make sure it was quality assured because that way it was ready for research right away. We do really want to empower researchers. We've had over 160 researchers engage with our data and over 45,000 websites embed our maps. We have inspired policy recommendations and journal articles, and we believe we're playing a small part in preventing the next pandemic, just playing a very small part by collecting this data, training future leaders, and hoping that we can inform future research. So we do have several data entry tracks on the COVID-19 Data Project. The first is daily numbers. This track collects and quality assures COVID-19 cases and mortalities. Next, we have the health equity track. This track collects data on cases by race and ethnicity at the county level. So the health equity track collects this race and ethnicity data. The policy track has collected and coded thousands of policies at the city, state, and federal level. And then finally, we have the newly formed vaccine pilot project. This is where we've begun collecting data on vaccine distribution. Each of these tracks collects data either daily or weekly, and we release it to the public monthly on GitHub, and we'll talk more about that at the end. Now, I'd really like to hand it over to our track manager, starting with Kelsey of the Daily Numbers track.
Thanks so much, Tracy. Hi, everyone. Thanks for joining us today. We're excited to share a little bit more about our data sets with you. My name is Kelsey, as Tracy mentioned, and I am responsible for overseeing the Daily Numbers data track. So in this data set, we track cumulative COVID-19 case data, and it's collected on the county level. This began in March of 2020, and it started on a single spreadsheet with just over 20 interns and has since grown to over 150 active interns within our track alone on 9 regional teams. Monthly, this data set trains 20 to 40 new interns to help maintain and collect data for this set. It's collected 7 days per week and has been since the project began over a year ago. I'd really like to take a moment to emphasize the sheer volume of interns working around the clock on this project to keep the data up to date and clean, and also the number that have contributed to this data set historically. It's really quite amazing how many interns have contributed to getting all this data together. The data covers all 50 states and territories, including Puerto Rico and Washington, D.C. To understand nationwide impact, this data allows the public to access a historically updated COVID-19 data set, which undergoes a QA process in the days, weeks, and months following initial entry. So what is in our daily numbers data set? So here you'll see an overview of our data collection process. Data entry and QA teams work together in 9 regional teams to complete the data set. Our data entry teams gather county data from all 50 states, Puerto Rico, and DC, as I mentioned, and this is based on timing of state publications. There's 4 variables we collect data for: confirmed positive cases, probable positive cases, confirmed deaths, and also probable deaths. Data is recorded on a county level from all 50 states using individual county and overall state sources. Next, our QA teams use a comparison set to do a check of our collected data. COVID-19 project data is unique in that the data is updated and corrected by our quality assurance in days, weeks, and months following the initial entry. We compare our data with that of Johns Hopkins University, New York Times, and USA Facts using an automated comparison set checker. This checks our data with specific historical sources to verify correct entry. We also use this to fix trend breaks on an as needed basis. So here's a snapshot of what our data looks like. States are broken down by county, and each date includes data for cases, mortalities, and probable cases and deaths. Methods are recorded on a Google Sheet, providing information on definitions and processes of all states that data is collected for. This is updated for each data release. These types of data are collected elsewhere, but our QA process makes this data unique. Full methods are available and released monthly with each release. And as you can imagine, the methods for each state vary. The full list of variables is included in our methods table and is provided here on this slide. The snapshot of what the methods look like is included below. However, there's so many variables, you can only see just a few in this snapshot. Monthly, we ensure that our case and death and probable definitions are updated for each state. Other variables are updated on an as-needed basis. Challenges with the daily numbers data set. Each state reports data in a different format. This is one of the bigger challenges this particular data set faces. You'll notice on the right side of the slide a snapshot of data from Arizona, and also below that a snapshot of data from Connecticut. In some cases, we can copy and paste totals over depending on the format. In other cases, we have to click through each county to display daily totals. The differences in data reporting formats can cause large variances in time required to complete data entry. Also, another challenge involves a large quantity of data, which causes QA processes to lag. Multiple reliable sources may report conflicting case totals in many counties. If the state is being notified of cases by individual county health departments, there may be a delay in the state's ability to report these cases as it processes new reports. You'll see here a snapshot of our QA comparison set sheet, which will notify of a discrepancy in the recorded data. Frequently asked questions regarding our data set, starting with, do states go back and update data historically? In this, is this reflected in Broad Street data? The short answer is yes. As previously mentioned, some do. It's reflected in our data set. One example is Kansas State. Our team does a monthly data burst to update the date that's historically updated by Kansas State, and this is done before every single release monthly. Where can you find our methods? The methods are available through a website link on our webpage, and they're also available in the GitHub repository. And finally, what differences and similarities have been noticed in how states are reporting or recording data? Most states publish their data sets through health department sites, but the format varies and usually falls into one of the following: .csv files that are downloadable, Tableau dashboards, and PDF reports, also press releases. We do utilize county pages for some data as it is more accurate. One example of this would be Facebook pages where the counties publish their data. And now I'd like to hand it off to Sabrine, who will cover our health equity data.
Thanks, Kelsey. So my name is Sabrine Benzacor, and I manage the health equity data, which is basically about race and ethnicity. So to start off, our health equity data set, as I said, collects data on cumulative COVID-19 cases by race and ethnicity at the county level. So we started collecting this data on June 15th, 2020, and we update it daily, or at least as frequently as the websites themselves update this data. Not every website updates daily, some update weekly, some update on like several days lag, for example. But regardless, we update our data set as frequently as states or counties will report it. So originally, when we started in June, there were about 750 counties that were reporting race and ethnicity case data at the time. But since then, the amount of county websites has actually grown, and we're now working with about 1,500 county websites. Some of them are centralized through state databases, and then some of them are just individual counties reporting this information. So it's definitely a huge undertaking. We've been able to scrape the data off of some of the state and county websites, but the vast majority of them need to be entered manually. Looking at it more broadly to contextualize, there are just over 3,000 counties in the US, which means that about half of all counties are reporting this race and ethnicity data, and we collect this information from all of them. So one reason why our health equity data set is so useful and important is because it's actually the only data set of its kind in existence that we know of. So there are other sources that report COVID cases by race and ethnicity, but they do this at the state level. So we are the only ones collecting this information at the county level, giving our data set a level of depth and specificity that you won't really find anywhere else. Additionally, in most of the states and counties that we work with, the case data actually gets overwritten daily. So most of these state and county websites don't have any form of historical data, which is why it's so important that we capture this data live every day. And we do this in real time. And that's, I think, why it's been such a massive undertaking and why we need, about 100 or 150 interns to help us out with this. So because of this, our data is uniquely situated to help analyze things like longitudinal trends and health disparities across demographics. So now I'll speak a little bit to our collection process. So as I mentioned in the previous slide, not all counties report race and ethnicity data, and the number that does has just about doubled in the time that we've been collecting this information. So because of this, we realized very early on that we needed to create a sort of iterative process when it comes to discovering new counties. So we established a county update process where we have a master list of every county in the US. And once a month, we go back to that list and we check every state and county website for those that don't yet report race and ethnicity data to see if they do. And then the ones that we discover, we add into our regular data entry spreadsheet, which I'll show you guys in a bit. But when we started out, we would usually find about 1 or 2 new states and then a bunch of individual counties each month. But over the past couple of months, we've started to see that sort of taper off. So instead, we are continuing to focus on the states and counties that we already have and just making sure that we collect as much data as they're reporting. So now I'll take you guys into a bit of a snapshot of how we do our data entry. So our spreadsheet gets cleaned up a bit normally and converted to long form for publication. So this isn't necessarily what you would see if you downloaded it right now. But we do have a wide form converter code if you would prefer to use data that looks a little bit more like this for your analysis. So essentially what we have here is we have the county names all the way on the left. And then this column is hidden on the spreadsheet as you see it, but is reported in the data if you download it, where we also have the FIPS codes for each county just to make it a bit easier to analyze. So those would appear in the final published version. And then we've also got the various races and ethnicities, all according to US Census guidelines. So we have white, Black/African American, We have Asian, American Indian and Alaska Native, Native Hawaiian, Pacific Islander, and then 2 or more races, which is sometimes considered like multiracial, but we just consolidated under that. And then we have other and unknown, and for ethnicities, we have either Hispanic, non-Hispanic, or not specified / unknown. So you can see the date at the very top, and then we report cumulative case counts for each county accordingly. And then we also total them up, as you can see on the right. Then we also have some dashes in the middle that you can see. So those are used generally to indicate that the state or county website doesn't report information for those races. So rather than putting a 0, which might imply that there are 0 cases, we put a dash since we don't know if there are actually 0 cases or if there are cases there, but they're just not being reported. So in the next 2 slides, I want to address a couple of the challenges that we face in collecting this data. So definitely the biggest challenge by far is that pretty much every state reports race and ethnicity data differently. I've included 2 screenshots of different state websites to sort of highlight that here. So on the left, you can see Ohio, which is pretty much the best case scenario where the case counts are reported as numbers. But the one little quirk here is that you have to search for each race individually, which can be a little bit time consuming. Then on the other hand, we have Indiana over on the right. And in Indiana, the data is reported in percentages that then need to be converted into numbers using the total number of cases for that day. So that's a process that we've definitely been able to automate since then and embed formulas into our spreadsheet to calculate those case totals out for us. But it was definitely a challenge in the beginning. So on the second slide, you'll see the Virginia Department of Health website. So this is an example of another challenge that we faced, and that is the challenge of health districts. So we collect this data on the county level, but in some states like Virginia, data is reported at the health district level, which is essentially like a grouping of several counties. And it's usually done to preserve anonymity in particularly small counties. So this was a challenge for us because there was all of this great data that was being reported at a level super close to the county level, but not quite there. And so we had to adapt. And what we ended up doing was we used Virginia demographic data to proportionally break down cases from health district to county, depending on the demographics of each county in the group. So places where we did this are specified in our release notes for greater transparency, but this was another challenge that we faced. So I'll finish us off with some frequently asked questions. One question that we get quite a bit is if other resources like the New York Times report this data. And the answer, as I alluded to earlier, is yes, but no. They do report race and ethnicity data, but they do it at the state level. And our data is uniquely situated to do it at the county level. So that makes ours a bit unique. As for how we ensure that our data is accurate, since there are really no other comparable data sets that we can use to check our data, this definitely also posed a challenge for us, but we do have peer review. So we get our data directly from the state and county official government websites, and we have every intern double check and peer review the data as it gets entered to make sure that there are no like quick errors of somebody putting in a wrong number or anything like that. As far as if states report historical race and ethnicity data, some do, the vast majority don't, which is why it's so important that we're capturing this data live. And some similarities and differences among the states. Some similarities, I would say, you generally see about 3 main ways that the data can be reported, either cumulative case counts, like just numbers, percentages, or sometimes it will be at a rate per 100,000. So we've definitely had to adapt that way. And then differences, again, differences in reporting, differences in whether historical data is kept, differences across archiving. There's a whole lot of special differences, but I think that part of what makes this internship and this data set so great is that we've been able to adapt and we've been able to standardize pretty much all of the data in our spreadsheet. So it's much easier to use and analyze. And now I will turn it over to Allison to tell us a bit more about the policy track.
Thanks, Sabrine. My name is Allison Muir. One of the things that I do on the COVID-19 data project is the track manager or the lead of the policy track. So the policy data set, as you might come to realize, is also very unique, similar to our other data sets. It originally began in April of 2020 in collaboration with the Temple University Center for Public Health Law Research. That group, CPHLR, reached out to us and we formed a collaboration using their methods and some of their scope criteria, and we turned it into a crowdsource process. When Temple's group was working through policies and looking at COVID policies, they were completing about 50 orders or reading 50 orders within a week, and each person in the group was covering a whole state. We kind of flipped that on its head, and we have a large number of interns, about 50 a week, working on over 100 orders, and they're able to read them, code them, clean them up, everything. As Tracy mentioned earlier, our data set includes orders from the federal level, from all 50 states and the territories, as well as city and county orders. These orders include emergency declarations, proclamations, statutes, anything and everything related to the COVID-19 pandemic. Our next release, which will be coming up soon, will include about 5,400 orders. Every month it varies depending on how many orders are released, but we are able to review orders within 1 to 2 weeks of when it was originally signed and published on the website where we find it. Similar to some of the other data sets you've already heard about, all of our interns work tirelessly and they dedicate their time and efforts, and I think they enjoy it. I really hope they enjoy it. Here you can see a snapshot of what our spreadsheet looks like as they work on things. Unlike some of the other data sets where the numbers are pulled from state websites, our interns are reviewing orders that are converted for them into a machine readable format, or at least a crowdsourced format using Google software. And then they are able to go through and read the orders for our scope criteria. They do this in a setting we call data bursts. It's like a group working meeting so that they are always able to ask questions of one another and work together to figure out the tricky orders or some of the terminology that might be new or unfamiliar to them. In the policy data set, like I said, we have a lot of different orders, almost 5,400 by now. What you can see here is what it looks like when you download part of our data set. So part of our data set is machine readable versions of all of the orders we're reading. Here on the slide, you can see the orders that we are reading that I mentioned previously. This is also what the format will look like. Because that is a large number of documents, we group everything by location and then by type of location. So first you would see the cities folder, the states, federal, and territories folder. And then if you were to go into the territories folder, you would see each of these territories broken down. And then again, you could open them and see each individual document just to try and group things and make them slightly easier to manage. In addition to the machine readable documents, we also have the qualitative data for each of those documents. As Temple's University Center for Public Health Law Research worked with us and collaborated with us, these scope criteria that you see on the right side of your screen are from our collaboration with them. So for each individual document, we will find the identifiers that make that document unique. So the number or name, where the document is affecting geographically, if it is an amendment or amending a previous order, the effective period of the document, if it's an initial declaration, if it is truly in response to COVID, because there are orders that are released not related to COVID during this pandemic, and then also if it is a order pertaining to reopening. The reopening of states, as many of you know, go back and forth, and there are a lot of details, so we do like to call that out in advance. The scope criteria for each individual document would be in a binary format. It's a 1 or 0 to tell you, yes, this content is included, or no, it is not included. These scope criteria's topics are not all inclusive of what we have seen in orders, but they are the most inclusive that we have been able to manage and keep on top of as orders come out. For the topics that are not included in our scope criteria, we do call them out and make note of them in the miscellaneous notes section. Here you can see just a breakdown of what one of our orders would be. So for this Connecticut order, I know that the order number is EO9F. It's in the location or affects the location of Connecticut. It affects Connecticut at the state level, And we also offer the FIPS code for the state of Connecticut. We put FIPS codes on all of our data sets should you want to cross compare them or combine them or look at every aspect of a certain location. I know just from this code that I see on the screen that Executive Order 9F amends a previous order. It was effective from October 8th to November 9th of 2020. It was not the initial declaration or emergency declaration. However, it is related to the COVID-19 pandemic, and it does not include reopening status. As Tracy Flood mentioned in the chat, the FIPS code is a unique geography code. We did not come up with that. It's something that we utilize. For this order, it is not related to stay-at-home orders or regulations, a curfew. It does have a mask requirement and details about a mask requirement. It does include details about a gathering ban and social distancing. However, it does not include information about operations for businesses, restaurants, or schools. It does not include information about medical procedure banning or reopening, especially elective procedures. It also does not include information about a travel ban for visitors or correctional facility operations. If you were to look at our spreadsheet or download our spreadsheet, each of the cells that has a 1 in it would have a note. So that note would give you more information and have information specific from the order, which is 9F in this case. As you have already heard, each state is a unique case and each state does things in their own way. Policy also faces the challenge of how do we manage each state being different? All of the states publish their documents differently, and not all of them are very accessible. In the picture, you can see an example of what the state of Indiana's orders look like. They publish their documents as a link, a PDF link, which you do have to have specific software to open. And we work to convert those PDFs into a machine readable format, or at least a familiar format like Google Docs, so that our interns can read them before creating the machine readable format. However, in order to do that, it often ends up looking, as you see on the right side, the pretty border that was meant to be unique turns into a lot of random letters, a lot of random symbols, and we do have to manually go through and correct those things. The formatting is not fun to fix, I'm not gonna lie. It involves a lot of hand typing and close attention to detail as our interns work through how do we fix this. Similarly, and kind of hard to ignore, when the orders are signed at the end of the document, many officials sign over other words. I know for myself, when I sign documents, I don't even consider that I'm signing over text. But when the document is meant to go online and become machine readable in a public format, those signatures actually impact what the machine is able to read and what the computers are able to translate. So those signatures end up causing problems. And again, we have to fix things individually. The images and paper type, everything is very particular to each state, and we do have to work through them individually and adapt, as Sabrine and Kelsey mentioned previously. Just some quick FAQs that we have heard as we have worked on this data set. Are there differences based on political representation? We have not seen a lot of differences based on political representation. However, what you might see and what stands out as a difference is if a location is rural or if it is more metropolitan. Those areas do often have different political representation, but they also have vast differences in the number of visitors coming and the number of residents actually living in those areas, and therefore affected by the orders coming out. So there are differences in the type of order or the scope of the order. However, the content is often very much the same. That's very similar to the geographical differences. It is based on whether it's rural or if it's more metropolitan. We have seen a lot of states that are more rural or more in the middle of the country come up with Amusing or comical orders, such as that the Easter Bunny and Santa Claus have had their vaccine, that they're able to come into your house and deliver presents, that they are not affected by the gathering ban. We have seen orders about vaccinations for the reindeers and how animals are affected. There's a lot of comical orders, I think, to bring levity to a serious situation we're all facing. Those were all released around holidays, but there truly was not a great difference during the holidays because the orders were all either still in effect or still coming out as needed. Similarly, with the vaccine coming out, more orders are still in place because the vaccine has not been a one-stop fix that everything opens back up, but there have been a change and a shift towards what does the vaccine rollout look like? What are the regulations for who's able to get the vaccine and how they will get the vaccine? However, the quantity of orders being released has not been affected. And with that, I'd like to hand it back over to Kelsey to talk a little bit about a pilot track coming out.
Thanks, Allison. Yeah, so we wanted to provide a brief overview of our new pilot project, which involves vaccine data. So this project started to capture vaccine data as an initiative in March of 2021. So it's fairly recent. And we started by archiving data for states that were overwriting their data daily to prevent further loss of data. And we also started entering data for several states at that time. Much like the daily numbers track, 4 data points are being collected: the first dose, second dose, single dose, and total doses. And the data collection framework is modeled off of the daily numbers track, with data being gathered at the county level if it's available for each state. Currently, data is being collected on approximately half of US states, and future goals include data capture of all counts in all states, DC and Puerto Rico, and also our first public release of a partial data set, and we hope to accomplish this by the end of May. With that, I'm going to turn it over to Aisha to give an overview of where you can find our data.
Hi everyone, my name is Aisha and I help Serene with the collection of the race ethnicity data. And today I'll be talking about how to find our data, these 3 data sets using our GitHub. I know some of you guys have heard the word GitHub, and if you're unfamiliar with what the GitHub is, it essentially is a code hosting platform that allows for code to be hosted and collaboration. In order to access our GitHub, you can directly click this link, which we provided, and the first thing you see is 5 different repositories. So a repository is essentially a folder, and 3 different data sets that we talked about: COVID-19 case and mortality, race ethnicity data, and state and city policies can be shown here. So in order to directly access our CSV files, you can just click the data, click the link, and then the first thing you see is just a description of the data, including any key variables, structures, and methodology, as Kelsey mentioned, which is updated monthly. And if you do end up using this data set, then you can scroll down and find a way how to cite it using this link. In order to directly access or download our CSV file, you can click this link over here and then go here to download. Just as a word of caution, these data sets are pretty extensive, so it may take time to download and load onto your computer. And for some computers, they have crashed when loading on these data sets. And to reach our race ethnicity data, you can just click the link over here, and it is separated by month, and it also has a description as well. And for the policy data, you can find the text files in a zip folder over here. So this is essentially how to access our data. And with that, we're going to continue on to the Q&A portion of the webinar.
We had some great questions that came in the chat, and I'm just going to ask the one that came earlier. So Kelsey, I believe this is for you for the daily numbers track. When did we start recording probables?
Yeah, that's a good question. Probables began being separated in very late July. So the first you will see that variable released would be with the August data set, or back as far as August.
Okay, that sounds great. And Sabrine, there was also a question for equity. Do you record your deaths by race and ethnicity, or just your case?
So we don't record deaths, and that's simply because they are not reported. We don't find cases, we don't find states or counties recording COVID cases and deaths. It's usually just cases. So that's what we've chosen to put back to you guys.
And also for Allison, I'm pretty sure this is for Allison. It's asking about what the effect of the inauguration this year was on your policy work.
So similar to the holidays, the election back in the fall, everything has come up within the orders in that it is included as a topic, but it has not affected the number of orders coming out or the exact content. It has simply been mentioned. So you might see within the effective period, the dates kind of line up with when the inauguration was. It has been mentioned, but there has not been orders specifically about the inauguration or a change in the great quantity.
There's another policy question that came up. Will there be any plans to include cross-national policy data?
I have to admit, I don't entirely know what that is. I am learning right alongside some of the others what type of policies are accessible and available. If we have cross-national policies that come out related to COVID, I don't see it not being included, but I will say we have not seen them so far.
There was also a question that came in throughout the meeting that Tracy addressed to the person who asked, but it asked about our funding. And basically our project is funded by the Backbone organization, which is Broad Street, which has donated the time, money, and resources for the entire project since March, and is the organization that is currently supporting the project. There's another question that came up. Do you all have an idea of when the project will end, and what are your plans after COVID?
So this one might be for me. So honestly, when we first started, I'm going to be very honest, when we opened in March a year ago, it was an 8-week internship. We opened it up, we called it Emergency Data Relief Internship, and we got so many amazing people, so many volunteers. We saw that there was a need for opportunities to not only collect data, but also to train the future leaders. And really, that hasn't stopped. We've gotten wave after wave of new recruits, and we've really enjoyed building the community. Having said that, states are beginning to wind down on their data reporting. We're seeing a lot of states stopping reporting or reporting only infrequently in regards to cases by race and ethnicity, as well as overall cases and deaths. In many cases, states are actually pivoting to start reporting on vaccines. So as we start to see states winding down on reporting, we do have to make the call. And when the data set becomes just a little bit too filled with gaps and to essentially say this is the last day of reporting. We're sort of anticipating it's going to happen at some point this summer, even though we do recognize that COVID is going to be with us for many years, that it's going to be part of the flu season, that we may see waves and changes in the years to come. The question is with such a cool community of people, are there other data sets that require that manual data entry that our team has become so good at?
Thank you for that, Tracy. Another question came in about deaths, but I believe it can be answered by both Sabrina and Kelsey. Are you collecting data on excess deaths or something similar?
So I can jump in. I'm not sure how you would define excess deaths, but I do know that within the daily numbers track, we report deaths as states report deaths. And sometimes states classify deaths differently. And so we record that within the methods that are attached with each data release. So if there's variation between how a state defines deaths, it will be included and outlined in the methods. Sabrina, I don't know if you have anything to add.
Yeah, I guess I'll just add that we don't collect data on deaths with race and ethnicity data, and that's simply because states and counties aren't reporting deaths by race and ethnicity at the county level, so there really is nothing for us to include.
Thank you for that. Another question just came in. Do you run into issues with underreporting of cases from different states throughout the pandemic? And if we have, how did we combat this?
So I could start and attempt to answer this. This is a really good question. When we are looking at collecting data from 50 states and they each collect data differently, it's very hard to capture and incorporate potential underreporting. We do see changes in methods by reporting over time, and that varies from state to state, which is why it's so important to us to include our methods with each release. This is updated in real time. Our regional teams are checking on definitions and the other variables that go into how states report their data. And that's reflected and updated with each release. So there are times where we see historic updates. Washington State will go back and update as new data comes in on deaths and cases. And we try to incorporate that in each new release. And if there's ever a situation where a state has publicly notified of a data update or a hold on case releases, we also incorporate that and make note of that in our methods. So we try as best as we can to keep track of and be transparent about how states are publishing and recording and notifying of cases and deaths. We try to keep up with that as best as we can.
I can add on too to what Kelsey was saying is that at the very, very early days of the pandemic, so we're talking about a year ago, when most of the country were all zeros, and then some places started to turn from zeros to ones, to 100s, to 1000s. In those early days especially, we saw a lot of state-to-state differences in what counted as a county case. So in some cases, states weren't reporting non-residents. So there were a few, I'm gonna just say like places maybe that had tourists, and in a lot of cases, the non-resident cases were a little bit buried in the numbers, or we had to go and find them. Now, obviously, COVID doesn't care if it's on vacation or not. So we really wanted to try to get those cases, by where the county case was found. And so that was definitely a process. And my understanding is that while states somewhat standardized, there's absolutely nothing standard about the state-to-state data. And so, as Kelsey mentioned, we try to do the best job that we can reporting the state-to-state differences so that people that are doing research can have a resource, even a longitudinal resource in some cases about how reporting changed in the states and how it's different between different states.
For that, Tracy and Kelsey. Tracy, this is another question for you. Is Broad Street a nonprofit, and how does the organization get its funding?
Yeah, it's a great question, and I'm happy to answer it. So Broad Street itself is a data and software company. So we're a startup that was created here in the Midwest. And honestly, we were in full startup mode, looking at data for communities under the topics of things like infant mortality and poverty and food access. And so we were solidly in this community data space. And when the pandemic hit, we essentially, all of the co-founders of Broad Street, it's a small team. We all sat around and we said, I think that we really need to be able to see where the county disparities exist, because it was appearing on the coast, it was marching inward with the cities. And we said, okay, let's do it. We opened up the COVID-19 data project. By that afternoon, we had 50 new interns and we were collecting data. And honestly, the numbers started rising so fast. We doubled our interns the next week. At that time, we were the only map. That's a little bit why it has 45,000 embeds, is because it was one of the first maps out there. Thank goodness it's not the only map or resource out there now. There's some really great data sources. I actually also saw John's question about, are we including other countries' data? And the answer to that is no, because we started looking at individual counties within the US, and we really doubled down on making sure that local data in the United States was taken care of. And we're really grateful for all of the great data aggregators like Johns Hopkins that are doing international data.
And Tracy, a follow-up question for you based on what you just said. So where can we learn about the pricing of your different data sets?
That's awfully nice. So first of all, anything collected by a volunteer intern is obviously free and open to the public on the GitHub site that Aisha just mentioned. So definitely feel free to jump on the GitHub site. If you've never been on GitHub before, it really is just a folder structure where you can store very large files. So it's just a regular CSV that can be downloaded. Any data that our interns and volunteers collect is obviously free and open to the public. In addition, we also have the COVID-19 data project, where we provide also freely available graphs on all 3,000 counties, as well as an embeddable map for those of you who want to share it with others. That embeddable map actually includes a bivariate map where we look at a measure of opportunities for improvement in socioeconomic status, and we compare that with COVID. So all of that is available on the COVID-19dataproject.org or GitHub. And then finally, broadstreet.io also publishes a COVID report. Broadstreet.io is free to use at first, and then once you reach a storage capacity, then we hope it's a reasonable membership fee so we can keep providing amazing data and obviously support initiatives like the COVID-19 Data Project.
Another question just popped up. When working with data, do you use any software such as SAS R or Python or QC, or is it mainly through Excel? And I believe the data entry teams of Kelsey and Sabrina can answer this.
Yeah, so there are several processes that our teams use. Initial data entry is just done in Google Sheets, so very much like Excel. The reason we use Google Sheets is because it's accessible by anyone, anywhere, at any time. So it's very usable, and it's the perfect format for the data collection process. However, we do have teams that work on maintaining our infrastructure, and also historic updates is one of the processes the daily numbers track has in place, and they do use Python in some of their processes. That's the main programming language they use for some of their projects on our track. Sabrina?
Yeah, so similar to Kelsey, we collect all of our data using Google Drive just because it's extremely accessible, and we have interns from all over the country and across many countries. So it's just the easiest thing, I think. In terms of actually cleaning the data and getting it ready for publication, we do use R and Python to help with the process of cleaning the data, but that's not our main method for collection.
Sabrina, do you and Aisha also want to talk about the shared SAS code?
Sure, of course. So we do have some converter code that we've used because I know for analysis, some analyses would prefer long format, just quicker depending on what software you're using, where some, like if you're using SAS, wide format is a bit better. So we do publish our data in long format, but we have converter code that some of our interns have used, and they wrote it with SAS to help convert the data into wide format. So however you would like to use it to analyze it, hopefully we have the code that will best suit your research desires.
And for those of you who aren't familiar with what long and wide format is, the way that Sabrina put it in the presentation, that's what wide format is, essentially many columns, but the data that you download from the GitHub is long format, so many different rows. But if people want to convert that format into wide, there's a converter code on our GitHub available to do so.
So anyone wandering over to the GitHub will notice that the data sets are in there, from the tracks, and then also some shared code that our different partners, people that have run datathons, have created and have shared. So we are trying to collect code that people are using to essentially digest the data in order to help others get a little bit of a head start in their own projects. Also in the GitHub, there's our state grades project, which also shares the data. We didn't talk about it, but just in case you see that folder there, it's there too.
We did receive a clarification question about funding specifically, since our data sets are available for free. Where exactly do we get funding to do our project and to pay our staff?
So thank you so much. So when the pandemic hit, Broad Street, even though it is a startup, and I think people know what that means for startups, and we did really think it was important to be able to commit funds to helping future public health leaders and to be able to create this data set. So essentially during times of COVID, we've been incredibly grateful for sponsors like Franciscan Health, who've been working with Broad Street for many years, as well as our other members. So Broad Street itself has about 10,000 members across the country from different nonprofit hospitals and nonprofits and government agencies, food banks, people that are doing really cool things in the community. Are Broad Street members, and luckily with that really strong base of support, we do have the funding to be able to support this internship and this effort. It is a COVID time and a pandemic time effort, and so as COVID winds down, obviously we'll be re-envisioning resource allocation, so that is a very real consideration, and thank you for asking that clarification question.
We don't have any more questions that have currently come in, but if anyone has any, feel free to drop them in. I mean, we're still on this call for another 10 minutes or so, so definitely if you have any questions, please ask.
Since we're running low on questions, we will continue to record the remainder of the session. If you have a next thing to get to, if you have another Zoom meeting to run to, then honestly, thank you so much for joining us today. Thank you so much for helping us with the Q&A portion, and Kelsey, Sabrina, Aisha, and the face, and Allison, of course, and the face I didn't quite introduce at the beginning is Guy. Guy is the incoming track manager on the Daily Numbers team. So a little bit of a fly in the wall, and we're obviously happy to have Guy with us too. So thank you everyone for attending, and we'll be sending around the recording either later this afternoon or tomorrow. And we're happy to stay and answer more questions.